So good afternoon, everybody. Thanks for tuning in. We welcome you for our first event in the IHH Healthcare Insider series. We have a great show for you today with very interesting guests. But before we get started, I want to ask Honam. Honam, we have these masks on, and of course we probably have to. How do we deal with the masks?
The trouble is with the mask, we can't speak clearly. So we're going to take off the mask so that we can engage the audience better. And of course, I need a sip of tea every now and then. So we'll take off all these masks here now so that our voices come up better. And then in turn, we can actually have a better engagement.
Yeah, thank you very much. And of course, Erica, on the other side, you don't have this problem because you're likely alone in your office. So look, everybody, thanks for joining. Thanks for tuning in. We have set up this quarterly webinar about healthcare topics, and we want to build a new communication channel to the capital market participants, to analysts, to our investors, to fund managers, to bankers, and we want to bring closer to you non-financial matters that have much more to do with our own business operations. We want to give you the opportunity to meet some of our executives, some of our leaders and operators in the business who actually are the ones who drive our success in our business. Now, the first session we have is, of course, around COVID-19. That's not super surprising. We want to make this interactive, so there are a couple of questions. We have guests, and I'll have a couple of questions prepared for them. We have some questions for you as the audience. I think there are 2 poll questions out there where we'll ask you for your answers, and we will have a Q&A section in the middle. But let me introduce our panelists. We have Dr. Lyong-Ho Nam. He is an infectious disease specialist from Mount Elizabeth Novena Hospital. Ho Nam, welcome to our event. We have Dr. Prem Kumar Nair, the CEO of our Singaporean operations. Prem, welcome to the show.
Thank you.
And we have Erica Lam, the CEO of Pantai Hospital in Kuala Lumpur, one of our key hospitals in Malaysia. Erica, thanks for joining us over the air tonight. Thank you. So, look, to introduce the topic, COVID-19 has a very unique effect on the world. It's uniting everyone in fighting this pandemic. A lot of collaboration, a lot of working together between countries, between scientists, between people in the industry, but it also has created a lot of divide. We can't travel, there are lockdowns, people have to stay home. There has been a fight over vaccine allocations, who can travel where and use what. So it's a real challenge for all of us today. Now we are starting the vaccination rollouts, and it has started differently in different countries. Let me start with the very first questions, and that's for the audience. The question is, have you taken or do you intend to take a COVID-19 vaccination? So please, 1 is yes, I've taken it. 2 is yes, I plan to take it. And 3 is no, I'm scared, I don't like it, I don't want this, I will not vaccinate myself. So please give your answers so we can have a first reflection from the audience. And while we are waiting for the questions, for the answers to come in, let me ask Honam, one of the features of these vaccination rollout is the clustering approach.
Yes.
So you older people or younger people or people in this part of the city or the other part, what is the background of this clustering? Is it useful? Is it helpful?
There are a few approaches to it. Like what most countries have done is that they look at the people who are most at risk. So this will be the elderly, those with comorbidities, with diabetes, etc. You want to roll them up because you want to protect them and in turn cut down death rates. You see your death rate comes down, the confidence and it goes up, and the confidence ability to win the virus is there. The second group you want to do is actually the healthcare workers, the ones who are dealing with, they are putting themselves at risk. They put their lives at risk, you ought to protect them. Now, Indonesia takes it a little bit differently because they felt that the ones who are actually spreading them out are the young people going to work. So Indonesia's view is that if I can control the spread, in turn I can control the death rates. So they went on next to actually vaccinate those people, the young fit ones who are going out to work. When they meet the virus, it brings it back home. You prevent the virus from entering the homes, you protect the elderly. Again, different countries have different approaches, and it really depends on how the virus is spread and who is at greatest risk.
Okay, that's interesting that Indonesia takes such a different. Can we know if Indonesia's success rate in vaccinations is better or in spread of the virus better than in other countries?
I think they are doing a great job. We actually see them having a queue for the vaccine, which is actually Sinovac vaccine. I'm quite happy to roll out. I think there's also another reason. It's like they actually have an ongoing epidemic in their country. Okay. And if you want the old folks to come forward to get vaccinated and in turn expose them to infection, are you doing more harm by actually getting them out of their homes? So I guess different countries will have their different approaches depending on what the situation is like. So Indonesia does have quite a lot of cases, and their approach, well, we just have to watch. 6 months, 1 year down the road, we'll know if that approach is the right method.
Okay, we have the answers coming in from the audience. 28% of the audience has taken the vaccine. 69% still intend to take the vaccine, which means that a lot of young participants here on the call, likely not in the eligible clusters yet. But we also have some people who say, no, I actually don't want to take the vaccine. I feel scared. I'm not certain if I should take it. Honam, does this reflect how people feel here in Singapore? Or
I think it's a bit biased. This is actually very, very good results. If you look at it, more than 97% expect to take the vaccine or have had the vaccine. In other words, the uptake rate is fabulous. And if you look at our own hospitals in Singapore, we're talking about at best an uptake of about 85 to 90%. So this is really exceedingly good. Now, we do know that people who take the vaccines are those who are better educated, those who read around and make informed scientific decisions, not based on fake news, but informed scientific decisions that this is good. So I think one thing is the audience which I'm speaking to are very intelligent audience. You guys know the value of the vaccines, and indeed the science information is filtered out to them. And we're seeing these exception numbers. Now the 3%, I don't think it may be simply because of fear of the vaccine. Some may be truly fearful of the vaccine, but there are many people with allergy risks. You do not know until you try for the first time.
Okay.
Now, just for the 3% out there, I'm hoping I convert that to 0% because many people with suspected allergies, they went for the vaccines, they were fine. And there's no way of predicting it until you take that leap forward. And if you have ever taken the vaccine before in your entire life, guess what? The risk of allergy is exactly the same as any other flu vaccine, pneumococcal vaccine, or shingles vaccine. Taken the vaccine before? Well, take another one because the risk is exactly the same.
Okay, that's really great. So we hope to see all people here vaccinated. Let me switch gear a little bit and go to Erica. Erica, we read a lot in the newspaper about public-private partnerships. The government has issued control orders on movements, but also has approached hospitals to say we confiscate beds, we need to put COVID patients there. How is this in Malaysia? How is this in your hospital that you are running?
So far, things are in control in a way. Though Malaysia government has issued an emergency ordinance in January, the MOH, our MOH did not take a high-handed or hard approach to sort of like confiscate it or take the possessions of private hospitals. In fact, what did they do is they had 3 rounds of meetings with all the private hospitals to seek our support in taking COVID patients. So far right now in IHH Malaysia, all our hospitals are taking COVID patients. It is just that depends on the level of the care. All the tertiary hospitals do provide critical care beds for COVID patients.
Okay, does the government assign patients to you that they feel should be treated in a private hospital because they have to take care of the COVID patients? Is there a partnership going on between public and private hospitals in your experience?
They currently, Malaysia government, Ministry of Health has undertaken to treat all COVID patients, regardless of whatever social status they are. So they do not assign COVID patients to us. However, we work on getting supporting the government by running some of the cases for the non-COVID patients. So we are treating some non-COVID patients assigned by the government at an agreed reimbursement rate.
So basically, we are relieving the government of difficult
Yep.
non-COVID cases, and with that, allow the government to really focus on COVID actions and improve the situation there. Well,
Yeah.
that's good. How many of our beds do we have roughly on COVID patients right now in your hospital in KL?
In IHH Malaysia overall, we allocated almost 10% of our bed capacity. In PHKL, we allocated or total about 24 beds. Yeah, 20 for not critical COVID and 4 for critical COVID. Yeah.
Okay, that's great. If I move to Singapore, Prem, last Friday, social media was full of news over the weekend. What's happening?
Well, we have a hospital-based cluster at the moment. One of our biggest public hospitals has got a cluster of COVID patients. As of today, there are 27 patients involved, patients and staff as well, doctors and nurses. But this is by no means the only cluster at the moment. We have approximately 9 open clusters in Singapore, right? We are now having to cope with that. So in terms of public-private partnerships, we are, it's an established sort of a process in Singapore. Long before COVID, for the last decade or so, we have been, MOH has been getting the private sector to help in various areas, notably in primary care. But with COVID, since last year, we have been doing a lot of things with the government. What it may not be apparent to many people is that almost all the COVID-related projects in Singapore are actually done by the private sector.
Wow, that's quite amazing. And look, if I look at your finance reports every quarter, then I see that there is some of that coming through in your numbers. This plays an important role for you.
Yes. So you know, I wouldn't want to take anything away from the government. We've got the NCID, the National Center for Infectious Diseases, which of course takes up does the heavy lifting with respect to COVID patients. But all the swabbing activities, all the PCR testing, is all done by the private sector. Vaccination centers in Singapore, and I think we'll probably be talking about that a little bit later, are all run by the private sector. And our wards, we have been taking in both COVID and non-COVID patients.
Do you have a number of beds that you assign per hospital to COVID cases?
Yes, so we have committed a certain number of beds to the public sector. And over the weekend, we have now increased the allocation to the public sector. So as of today, we will start taking in more COVID patients into our hospitals.
Okay. Erica, if I switch back to you, the vaccination rollout in Malaysia, how is that going? How far are we in the rollout, and how are we helping in nurturing that?
So currently, Malaysia has already completed phase one. In Malaysia, the vaccine program will be in three phases. First phase will be the healthcare workers, frontliners. Second phase will be elderly, high-risk individuals. Then phase three will be going on to public. So phase one we just completed in end of April. So currently, what happened is private hospitals selectively being recruited to vaccinate our own frontliners. Pantai Hospital Kuala Lumpur has been appointed a national vaccine center for that. So we also vaccinate healthcare workers from GPs, dentists, all the way to ambulatory care centers, nurses, and what's not. So now we are moving on to we are all recruited as well. Moving on to the phase two, which is the vulnerable and the high-risk individuals. The percentage of take-up in Malaysia is still pretty much confined to city. Rural areas still pretty low. So that one, the government has decided to loop in even general practitioners to run the programs in the rural areas. Yep.
Okay. So, Prem, on that renewed rollout, you said 27 on this renewed cluster of infections. So you said 27.
27 individuals in the Tan Tock Seng Hospital cluster.
Right.
But we have got 9 other smaller clusters around Singapore.
And how long would it take for the government to take control of that, to see, okay, these clusters are under control, and it kind of rolls?
Well, actually, most of these clusters are well controlled. Singapore has a very established system of contact tracing. They call it, the traced, test, isolate. All right, the TTI program. You do contact tracing, you test them. All right, if they are positive, you isolate them. Right, so we are doing it for all the clusters.
Okay.
Right, so there is an established mechanism, and it works well. We know that it's been written about internationally as well. So each of these clusters. So when I say open cluster, it doesn't mean that it is getting worse or expanding. All right, they control the clusters, and after a few weeks, it is closed. All right, you must remember that for the last few months, we've hardly had any clusters. All right, but we are beginning to open up. Right, Singapore has not closed its borders completely. We are still open. We are allowing Singaporeans, residents to come back. We are even allowing a certain number of patients with critical conditions to come back. All right. So we do have a little bit of risks, and from time to time we will have some clusters developing. All right, but they are quickly closed down. All right. So it's well managed.
So are you looking forward to the travel bubble with Hong Kong, or do you feel that's a bit early?
Okay, the travel bubble with Hong Kong.
And it's not a political question.
Well, the travel bubble with Hong Kong is based on certain parameters, right? Like I think there's a moving average of less than 5, right, before it can start and continue. So although they've announced it, I think some of the recent outbreak in Singapore and in Hong Kong, by the way, there's also a whole building that's been sort of closed off, may affect the travel bubble. And I think this is something that we will have to take into account as we cautiously open up, right? We are planning, I'm sure, to open up possibly to Australia, to New Zealand, possibly UK, all the countries that have got, who are controlling the situation quite well. But there will be ups and downs. I mean, like Honam says, it's not going to be a smooth, journey and forever.
We'll come to that. But I mean, there is a difference. If I look at Erica here, there is of course a difference if you are sitting in a city country or country city like Singapore, like Hong Kong, or if you are in a very large a country with many millions of people. So I'm sure, Erica, for you in Malaysia, it is much more challenging to do contract tracing and do all these things. Is that correct?
Now it's because nationally we are using this app called My Sejahtera. So the contract tracing is there. It is now asking them to either stay at home or either to get admitted. That's where it turns out to be a little bit of an issue. So yeah. So in rural areas, they are not so bad, but because of the interstate travels, has been allowed by a special permit and what's not. So that somewhat spread the cases to certain states that used to be green zone. Yeah.
Let me go to the second question. We want to ask the audience again about the vaccine itself. How much do you know about the different vaccinations that are being offered? One, I'm well versed, I understand all this. Two, well, not too much. Three, I know, I don't know much. I don't know nothing. So can you share your answers on here on the screen? And I would like to move to Ho Nam and ask you a little bit about the different vaccinations. There is hot vaccination and cold vaccination and genetic programming and AstraZeneca and so give us a little bit of a for layman. We're all finance people here, so but
no, it's okay. Money talks. Money talks. So I'm going to cover about four different brands of vaccines because they're more relevant to the people around here. The first two is actually Pfizer and Moderna. These are mRNA vaccines. So what happens is that there's a coding. It's a coding to tell the body to make a protein out. And in this case, it's actually a protein for the virus. So instead of injecting the protein inside, it asks the body to make the protein out. Okay, so I'm going to use it in the context of Southeast Asia. It is like a recipe book. You give me a recipe for nasi lemak comes out. You give me a recipe for laksa comes out. But nothing more comes out from there. So you give the jab, the laksa comes out, we react to the sedap laksa. We love the laksa, and then the body mounts an immune response to it. And that has been fabulous results. We're talking about 94 to 95% efficacy. Now, in the case of AstraZeneca, which is also available in Malaysia, they uses a carrier, adenovirus, to actually put that coding sequence inside. Again, there's a nasi lemak or a laksa recipe, and it codes it out. And we have very, very good results as well. We're talking about 90% efficacy. Now, Sinovac, which is the China vaccine, which is available in China, pre-purchased in Singapore, they use a very traditional method where they use the whole virus, killed it, put in a little bit of seasoning to it. It's almost like the Southeast Asian instant noodles. If you just give the noodles alone without the seasoning, the body won't react. You won't get a repeat customer. But if you have the instant noodles and you throw in the seasoning, which is alum, which is an adjuvant, immediately the body responds well to it. Now, however, the Sinovac data is not tremendously fabulous in the case of the mRNA vaccines. But nonetheless, we do see efficacy of at least 50 to 60%. Indeed, Chile actually released some data, real-world data, saying that Sinovac has been able to protect some of the elderly. So, 4 different choices, again, 4 different results and quite different methodology. So I want to stress to you at this point in time, the world, honestly, is short of vaccines. And if you want to vaccinate every single person at the end of the day, it will take us until 2023, if not 2024. The fact that you and I are here and we're able to talk about vaccines, it is a huge blessing, it is. And never before has a vaccine been able to approve so quickly, gone through the rigors and testing, gone through the examination, and we passed it. So what's important now, perhaps it's not so much of the 94 or 95% I should take, or the 90%, or the Sinovac vaccine. Instead, any vaccination which you receive is going to help you, protect your country, and of course, health is wealth. You have health, the whole company, the whole economy moves along again.
These are some really strong messages, and it's interesting. We have half a result here on the questions. Half of the participants are actually quite well versed, and half of the participants do not know much. Can I enter on one specific mRNA? What does mRNA mean?
Okay.
And is this a new technology, or is it something that exists a long time but
I'm
never
so
marketed?
happy you asked me about it. mRNA stands for messenger RNA. Now, if you realize our body, our cells, the fact that I have a receding hairline and black hair is because of my DNA coding. I blame my parents for it because my parents gave me, and that's in the DNA. But the DNA is at the nucleus, the brain of the cell, and it gives out instructions to the kitchen with mRNA. So it hands out recipe books, do this, do that, do this, do that, and with mRNA. So what mRNA does is when you inject it, it goes into this process on the machinery that is already inbuilt. The kitchen that's there, you just shove in the kitchen recipe book, and the body just makes exactly the protein that's required. So I want to stress to listeners and viewers here that it doesn't change the DNA. The DNA is in a Fort Knox, or what we call the nucleus. It can't enter the inside. So it can't change the DNA inside. In fact, when I had the vaccine, my girls was asking whether can I change you to a K-pop star. They were rather disappointed because they had instead was more receding hair. So it doesn't change the DNA inside us. It just makes exactly what it is. And one point which you probably realize is mRNA suffers from you need a very cold temperature to preserve it. And it's a minus 70 or minus 20. In fact, if you take it out, it gets destroyed very quickly. So our body temperature is 37. We obviously are not cold-blooded creatures. And when it jabs inside, the temperature will try to destroy it. And of course, when there are too many cooks, you spoil the broth. So the nature of the cell is they will destroy every cookbook that comes along. Hence, the mRNA resides in your body for a very short while, just enough to make that sedap laksa or the sedap nasi lemak, and you eat it, the immune response mounts to it, you're good. So I agree, this is still a new vaccine. What are the potential problems? Well, actually, don't look at Singapore, don't look at Malaysia. Look at USA, look at Israel, look at UK. We have more than 100 million people vaccinated. And the number of accidents and problems that come up, extremely few, which means we are doing well. If you look at the Israel data and the UK data, we're talking about less deaths, less hospitalization, less ICUs. And if you talk about USA, President Biden just said mask off on the weekend when you're outdoors. I think it's a bit too much of a proclamation, but it tells you that they are pushing vaccines, help us push back the virus. We regain lost ground. And mind you, this is a battle for our lives.
So it all goes back to this term herd immunity that I'm sure nobody knew about 1.5 years ago. But now it exists, right? It's herd immunity. What is herd immunity?
Herd immunity is the number of people that have been vaccinated in the population. I'm going to give you a little example with 4 little people, 4 little fingers. Okay, let's say that these 4 people have not been vaccinated before. The virus comes along, hits the first one, passes on, and all 4 will fall sick. But if a herd immunity, let's say in 3 out of the 4 persons, the virus comes along, the first 3 people can actually block the virus, and in turn prevents further spread in the population. So that individual, the last one who can't be vaccinated for various reasons, allergy, poor immunity, cancer patient, suffering, not suited for timing, then this individual gets protected. So the herd immunity is very important, and that came about from all the vaccines in the past. From smallpox that was eradicated, to polio that's practically gone, to measles that was very good until recently when the herd immunity came down to less than 89%. When that happens, the virus can penetrate through, weave through the fingers and catch the person last one there. Now, the herd immunity story doesn't work well for COVID-19 or the SARS-CoV-2. The chief reason is that the immunity to the virus wanes with time. And it wanes like a natural infection even if you had a vaccination. So, and the kind of protection which you have is directly dependent on your antibody levels. The higher the antibody levels, the greater your protection will be. So in fact, if all of us have been vaccinated all at the same time and all of us have excellent antibody levels, hey, the virus can't get a foothold on me. But Obviously, that's not possible. Rollout of the vaccine, even in super fast Israel, took several months, and they have not completed it yet. So high immunity will protect you. But with time, it comes down, which means you may need the third dose, a booster dose, to keep the level high. So the message today is clear. The amount of antibodies which you have will protect you. The antibodies will wane with time, and when it reaches a critical level, you may need a booster shot and in turn bring it all the way up again. So that's the message, and with that, we can build up the herd immunity and move the whole nation and perhaps the whole world into a COVID-free era, perhaps.
So let's stay with the science a little bit. America, apologies, but let's stay with that for a second. So the whole thought around mutations. So now I'm vaccinated. I got my first shot. I'll have my second shot in, I think, 4 days. And I hear about people who have been vaccinated and everything is good. But now comes the mutation. Do I need another shot?
Okay, two issues here. First one, even if you have the shot, 2% of the people in the best case scenarios still end up having insufficient immunity. That's a given. Nothing is 100% in life. Okay, that includes my kids' mathematics. When I try to coach them, they'll never get 100%. So number one, you do have a failure rate of 2%. The second thing is that the vaccine which we have developed targets the original virus. So we are adapting by throwing out with vaccines, but the virus adapts by mutating. When they mutate, they literally shift the goalposts. So I gave this example to my Brunei nurses. What do I do with the mutants? So when we are studying for nursing board exams, we know the syllabus. We aim well, aim good, we get 95%. I pass. But now the nursing board suddenly changes the syllabus without telling anyone. Indeed, the goalpost changes. So instead of getting 90% or 95% pass, I get 80% pass. Is that good enough? To be honest, I think it's still good enough. Because not only are you looking at 80%, but let's look at the 20%. Of the 20%, you may not score well, as in you still end up with an infection, but you end up with a milder infection. The lesson to learn is this. The vaccine converts a severe illness to moderate illness, a moderate illness to mild illness, a mild illness to an asymptomatic nothing illness. If it's a nothing illness, it becomes a common cold. A deadly virus becoming a common cold, then we have won the war against COVID-19. And indeed, we can. We can if we do two things: vaccination for everybody on one side. The second thing, which many people don't talk about, is the second arm is actually the prevention of replication. If the viruses stop replicating, they stop mutating, the goalposts stop shifting. Can you imagine football? UEFA Cup, you miss because the goalpost shifted. But as long as the virus keeps replicating and mutating, the goalposts will shift. So everyone, it's not just me, not just the odd people here, not just the audience, but everyone on this planet Earth will need to get vaccinated at the same time with good masks and good social distancing. When the replication stops, the mutation stops. When the vaccinations are given, the protection starts. And together, we can still conquer COVID-19.
Let's talk about the replications a little bit later. That's an interesting thought, and I have not heard many people talk about this. It's all about vaccinations, but not about the replication stuff. Let me ask, Erica. Malaysia has moved to an AstraZeneca strategy. Is there a different response from the population? Do you feel there is people would have liked to have other vaccinations, or how is your response in Malaysia on this AstraZeneca vaccine?
So currently in Malaysia, there are 3 vaccines being approved, and it's in the program. So the first one is Pfizer, the second one is Sinovac. These two are already in the public health program, vaccination program. On AstraZeneca, initially it was meant to be in the program as well, but due to some cases reported, small rare reactions cases reported in the world, so the government has made a decision to make it a voluntary, as in any public, they can make an appointment to say, I would like to take the AstraZeneca. Whereas for Sinovac and Pfizer, no, public doesn't have a choice. So long as your appointment is given, you are assigned to this particular center, this particular day, you say you're going to get vaccine, so they will just give it to you. You do not have a choice which one you want to choose from. But AstraZeneca is open up for people to sign up. So on the 1st of May, it was started, 2nd of May was the first, the portal was open up for public to sign up, to make appointments to take the AstraZeneca. In 4 hours, 260,000 doses slots were taken. Yep.
So basically, people do take, Honam, what you
Yes.
recommended to say we got to protect ourselves first. That's the most important,
Yes.
regardless of whether I'm now at 75% or 90%. And this whole discussion around that one vaccine is better for younger or older or whatever people, is that a myth or
There's some truth in that. Very quickly, the AstraZeneca has a small risk, the AstraZeneca vaccine has a small risk of a clot. The risk is about 1 in 250,000, or there's 4 per million. Really rare, it's like striking the third prize in a lottery draw that's held every month. Very slim, and it happens in people who are less than 60 years old and the women. So hence, they are saying that if we should give it to the older folks for the AstraZeneca, hence we avoid this risk. But if you think about it, 1 in 250,000, that's extremely, extremely remote. Okay, the risk of dying from a road traffic accident in Singapore is 21 per million. The risk of dying from smoking is about more than 2,000 per million. So if you put it in context of it all, I would take the vaccine and hazard a risk of 1 in 250,000 versus the real risk of death of 1%.
So it's a little bit like this microscope effect. You just have to look close
Correct.
enough and you'll find a problem.
Yes.
But maybe it's not really such a huge problem. We have the first question from Abhijit from the audience. And maybe, Prem, I'll ask you that. What role and responsibilities do you see for specialty hospital chains like IHH in terms of preventive primary healthcare reach out in mass markets like India and Indonesia? It's not your market, but maybe you have an immediate response to this.
Yes, thank you for the question. So, York, I would say that I am a great believer in doing as many things as possible outside the hospital, right? And what do I mean by that? So, even in normal times, pre-COVID times, right, hospitals are where you deliver acute care, right? If you have a good primary care system and a preventive care system, you push as much of the care as possible to the primary care setting, right? And leave the hospitals to do the acute, higher and more complicated work, right? In COVID now, right, so take the situation now in Singapore, right? A lot of the COVID related projects are being run outside the hospital. The 40 vaccination centers that we have are all located in community centers, right, in some of the buildings in residential estates and all that. So other than accessibility, you're also preventing people from going into hospitals for these things. A lot of the lab testing, right, is being done in testing centers which are also all over the island. We must leave the hospitals for the patients who get sick, right, and need to come in for people like Honam to treat them because they've got an infectious disease. They may have lung complications, right? So that's the same advice I would give to any country. I know India is in the midst of, a major surge, right? And it's difficult to handle such a big, complicated situation. But look at what's happening. The hospitals are overwhelmed, completely overwhelmed, all right? Some patients actually do not need to be there,
And what you try to say with this is that because we do not have enough primary or pre-hospital
Yes.
facilities, care, support, suddenly everyone is flocking to the hospital and then creating this challenge.
Absolutely, yeah.
And you're advocating a much more broader perspective and say, hey, try to keep people out of the hospital
Yes.
as early enough.
The system needs to work as a whole, all right? Primary care, secondary care, tertiary care, in some instances, quaternary care, all right? Of course, if all the allied services, support services, laboratory and pathology and all that, right? But what I'm saying is, right, in peacetime, when you're not having problems, build up the primary care system. It's absolutely crucial. And train the people, all right? Train the physicians, train the nurses to do as many things as possible in the primary care system, be it private GPs or government polyclinics, all right? So I would say that this is a strategy. You see, every time we have a pandemic like this, there are lessons to be learned. Singapore learned its lesson from SARS. Again, Honam was involved smack in the middle of it, right? So we learned. So we built up our isolation facilities. What is the NCID? The National Center for Infectious Disease. It was a center that was designed after things that we learned from SARS, all right? What does this show now, all right? There are also lessons to be learned from COVID. And I think one of the most important things is to build up the out-of-hospital system. We have started that journey in Singapore over the last decade or so, and I would actually commend that to many countries.
Is IHH involved in this?
Well, IHH certainly in Singapore, in Malaysia, in China, we've got primary care operations, right? So look at what's happening in Singapore. The ministry says, can you guys help us to swab the dormitory workers? We say yes, and it's done by our primary care team, Shenton. Shenton is now in the forefront of COVID vaccinations. It's in the forefront of swabbing. It's in the forefront of border screening. What we have not spoken about here is we, at the borders, at the land borders, we are screening the truck drivers who bring our supplies. They are our lifeline from Malaysia.
Right.
Right? So we are doing temperature screening. We are doing antigen testing. Honam alluded to it. Antigen testing, which is a quick and fast way of detecting COVID, right? And we are vaccinating them. So we are doing 3 things in one go with a group of people.
So actually, we are involved in this pre-hospital
Yes, very much so.
phase, and actually our cluster strategy that Kelvin has brought to the company and is promoting so much is exactly that. How can you broaden the healthcare spectrum from large hospitals to pre-operations?
I'm going to chime in very quickly, and perhaps with a bit of a prescriptive method for those people that are suffering the COVID-19 now. Now, if 80% do not require hospitalization, if you actually run with the emotions, everybody will use the hospitals and the hospitals will be swamped. Just like hypertension. Can you imagine hypertension that's only managed in the hospital? The hospital will be swamped. Yeah, the specialists will be rich, but the hospital is swamped. So the method then, the love message to the people will be, number one, not everyone is admitted. Only those who truly need it gets admitted, number one. And let's look at the oxygen levels. Number two, prevention is much better than treatment. And prevention means masking, social distancing, don't go out. Please don't join the rallies. There may be certain festivals, don't join them. Because you are just going to feed the fire. You are wood. You are fuel for the fire. Stop it. You keep your distance. You keep your mask on. And you know what? The virus can't enter into your house. You are safe. And these are preventive measures which can be driven by the doctors. And when the doctors drive this message out, they are free to do other things, from vaccinations to more education. Right. And in no time, what's COVID-19? But something of the past.
Very, very, very strong suggestions. Let me, Erica, maybe bring the next question to you. There's another question from the audience, and the question is: with the resurgence of COVID, but at the same time a good pace of vaccinations, do we still need COVID-19 swab tests? or do we expect that testing will slow down over time? How do you prepare for a growth or a shrinking of swab tests? Do you think there's an impact? And how are our laboratories and diagnostic centers responding to this?
With the surge of the COVID-19, we would not slow down the testing. So it is exactly what the Singapore government is approaching. Once you test it, you isolate the individual. If not, you're going to treat them in the hospital. So we do not slow down in testing. So long as a patient, there is an individual being tested positive, then we will trace a contact tracing. Then we will start from there. So every individual will go for the testing before they can consider they recovered from COVID. So that part we should not stop for now. But will there be, after vaccinations with a large population, will we have to stop the testing? I think it's too early to decide at this point in time. So at this point in time, as you speak, it's only less than 3% in the Malaysian populations are vaccinated. I guess this is more pertinent for us to consider when we reach about 30 to 50% of populations are vaccinated. Yeah.
But we are, with our laboratories and diagnostic centers, we are prepared, we are there, we offer all these services to the public.
Yes, we do. We do.
I mean,
we do on-site.
It is in fact a growth area for all the markets.
Yes, it is. It is a growth area. So, I'll give you an example. I'll give you a statistics. Last year, 2020, since the onset of the burst of the pandemic, the entire Malaysia tested 3.4 million tests done in 2020. But just this 4 months of numbers, it has shot up to 4 million in total, public and private together. So you can think about that relativity.
Let me jump to one question from Wee Kwang. Can a vaccinated person be a carrier of the virus?
Yes.
Or will he or she be considered infected or asymptomatic, since he or she will be able to pass this along? So maybe Honam, a vaccinated person, can that still be a carrier?
Potentially. The science is still being proven at this point in time, and I know they are doing active studies on it. Very briefly, when I've been vaccinated, I have immunity, the antibodies will protect me in the blood. In fact, the antibodies will be excreted out onto the nasal lining. So when the virus comes in and I breathe it in, it will it's literally trying to put onto the landing point. And the landing point, they'll try to infect. The antibodies are going to try to neutralize it. And to a certain degree, there is significant protection. In fact, we do see fewer viruses in people who have been vaccinated compared to unvaccinated group. The question then is, can this still infect? If you think about it, this virus will then be coated with antibodies if it's sufficient. So again, it boils down to the question is how much antibodies you have. The more you have, the more you can overcome the mutants, and the more likely you end up asymptomatic or no transmission. Now the virus then in turn, as I speak, as I cough, I'll pass it on. Potentially 1 or 2 may still infect. So potentially you can still infect others, which means social distancing, masking must still go on so as to not pass it on. Remember, the purpose of masking and social distancing is to stop the replication, stop the mutation. And when I mask up, I'm not doing it for my social personal benefit. I'm protecting my neighbor, my brother, York, or Prem, so that they don't fall sick. And when I mask up, I'm actually blessing them with love.
Okay. Wow. So people mask up. Masking is still
it's a sign of love.
Very important.
Yes.
And you do it to protect the other, not to protect yourself. I think that's a good message.
So importantly, eventually, everyone must, I think at the end of the day, the risk of transmission is low. We do have a few people who have been vaccinated, who fell sick, but the people around them didn't fall sick. I think the chance is there, but much, much slimmer. Hence, even if there's a risk of transmission, is lower, so vaccination works. The analogy is this to my kid. My kid didn't manage to get 100 marks on the exams, But I still push him through the education because it's going to help him even if he didn't get 100%.
Let's look at one question around. So what happens in the long term? And look, Prem, you run a highly successful business. Those of us here on the call who look at our financial statements, they will know you had a great Q4. We're not going to say anything about Q1 yet because we shouldn't. But look, you run a very successful business during COVID. If this drags out, if this is with us for a longer period of time, what does it mean for you?
Okay, the first thing I have to say is that we are fortunate in IHH SG to have a spectrum of businesses that support each other. All right, we have primary care in Parkway Shenton. We have got hospitals, 4 hospitals, right? So we are the biggest private hospital chain. We have got laboratories, we've got pathology, we've got radiology, right? We've even got a college. So we've got the entire spectrum of business. So what does that mean? When we have a situation like this, we try and adapt by getting some of our businesses to do more, all right? So a very good example is in what I call peacetime, pre-COVID. Our primary care business is really general practice, right? Health screening, preventive, and as Honam said, some chronic disease management because hypertension, diabetes, you want to manage it at the primary care level, right? When COVID came up, our hospitals were affected because foreign patients went down, right? But what happened to our primary care side? We ramped up, and all the things I told you about, from swabbing, PCR testing, right? The vaccination centers ramped up. Primary care became one of our star businesses, okay? And it continues till today. There was a question about whether when you have vaccinations, do PCR tests go down? No. Today, we have got a request to start doing more swabs, more PCR tests, right? So, because we've got this whole armamentarium, as I call it, right, of services, we are a lot more flexible. So what's happening in our hospitals? Foreign patients went down. That's predictable, right? We knew it. So what are we doing? We are working on getting local patients into our hospitals. Does that make sense? It does, because the public sector is fighting a big war out there, all right? They need to conserve some resources for COVID operations in hospitals. So they are trying not to take in too many elective cases or non-emergency cases or even the regular outpatient visits. So they are now swinging over to our hospital. So we have seen since Q4, all right, the number of local patients coming into our hospitals, all right, for acute treatment, for elective surgeries, going up. So as a system, we've got a balance, all right? Sometimes this goes up, sometimes this goes up.
But basically what you say is this crisis has made you more resilient.
Absolutely.
Has broadened your business focus and actually brought a lot of new revenue and, of course, margin generators to your business. Erica, how does this look for Malaysia? I know you are much more affected by the movement control orders. Patient levels have dropped quite substantially. How would a prolonged crisis have an impact on your business?
Certainly, it has gone quite bad, especially when we do not have the medical tourist part, and because of the movement controls, patients could not travel, interstate travel. Being a tertiary hospital, a large number of patients are coming from outstations, meaning out of Kuala Lumpur states. So this has somewhat affected us. What we do now is to continue to write on the green bubbles trap medical tourist. At the same time, because of the recent ease out of the movement control orders, patients are start coming back. And also, I think private patient has been holding back not to seek treatment for about the last whole year. So there are many cases come to my hospital and turn out to be a pretty serious state. So indirectly, the case intensity has gone up, shot up pretty high in Bandar Hospital Kuala Lumpur. Yep. So that's somewhat actually balanced up the entire business. Of course, it has come down. It has not gone back up, but at least it is still sustainable at this point in time. Yep.
Interesting how you describe your response to the crisis, a little bit different to Singapore, but still there's a lot of similarity in terms of diagnostics and auxiliary services.
Yeah.
And look, I also recognize that in Malaysia, the team has resorted to cost management and cost measures in the non-care related areas, back office and so on. So actually quite solid response there. Very, very interesting to hear. We have the last a couple of minutes of our, in my view, very interesting panel discussion, but I'd like to bring this back to Ho Nam. We have heard herd immunity is important. And one of the questions here from Isaac is, well, will actually every country reach this? And if we don't reach it, what happens then? And what does the science bring for us? What is happening? Is this ending? When are we through this?
Okay, so we will eventually reach herd immunity. There are a few ways to do it. The preferred way is get everybody vaccinated. And not only is it vaccinated, you will have to check the levels in terms of antibody levels, and thereafter, if it falls low, you get vaccinated again. And it echoes exactly what Prem has talked about. Vaccination now, and then maybe a year later, or 18 months, or even 2 years later, revaccinate again. Do you have to use the same vaccine? Possibly not. It could be mRNA now, it could be a different vaccine later. But science will subsequently show you whether can this mixing be done. In theory, it's fine, but like all things in medicine, we need to show that it works. So herd immunity can be from vaccinations, and that's great because we heard about it again. Vaccination reduces a severe, life-threatening killer virus to that of a common cold that doesn't hurt. Now, the second way of reaching herd immunity is to get repeated infections. As you realize, you can be infected once, then you'll be infected again, and get infected again. So with every cycle of reinfections, you're going to get people falling sick, hospitalizing, dying, putting the entire hospital into strain, but eventually those people who survive are those who are much of stronger constitution to begin with. Number two, they have the ability to mount a strong immune response, and the immune response kind of stays quite high, either for repeated infections or that the body eventually learns how to cope with it. Now, that's a route which I do not encourage anyone to go. If you look at how the Swedish model went, they're looking at big numbers of infection, they're looking at big numbers of hospitals are coming down. What we really need to do is to get vaccination to each and every single person, not just in our countries, not just in the region, but on our entire planet. Remember this, the world marches out of COVID-19 at the pace of the slowest nation. So until the last nation is conquered, or until the vaccine reaches the last individual, my dear friends, my brothers, we're still going to be suffering in COVID-19 subsequently. And unfortunately, this will be the way forward for many years. Well, that's quite gloom, isn't it?
That sounds gruesome. Well, give us a bit of give us some positive news.
Okay, the positive news is this. We have done it in the past. Many countries have shown you the way. We can do it forward. Number one, out of the window is individualism. We're talking about wearing a mask because I love my brothers here. Okay, all of us must beat our hearts at the same pulse where we wear masks and do our social distancing. Number two, out with nationalism. Whoever has the vaccines and push it on to the other people and help the other people. We see it happening in India when there are situations there, the rest of the people, the rest of the nations are sending help there. You see, India, if it controls unbelievable mutations happening there, what will happen? The ultimate, totally resistant COVID-19 will be birthed from India. We saw it in the antibiotic resistance. They even named it NDM1, New Delhi metastases. So you could have another new COVID-19 altogether. So if we don't help India, then we are exposing ourselves. In fact, the Chinese have a phrase, if the lips are not there, the teeth will chatter and chill, because all of us work together for the benefit of each other. Once the vaccinations are out and rolled out, and it means WHO coming forward to say what vaccines work, what vaccines don't, and should even copyrighted vaccines be taken away. And we saw that happening in our northern counterparts in Thailand. They were raided with the HIV virus, and what did the pharmaceutical companies say? Let's stop it. Let's stop this copyright thing. Get the vaccines to the people, get the medicine to the people, protect everyone first, get it under control, and thereafter. Unfortunately, IHH doesn't have the power to do that. We need leadership, not just in the region, we need leadership from the world. And you know what? I think the human race has the tenacity to do it. In fact, we have the science, we have the knowledge. Never before has science been so advanced up to this stage. And if you think about it, without this science backing it up, many more people would have died. Audience, we have achieved so much. Singapore and Malaysia. And all we need is a little bit push more, and this spread, this love, this solution can go out. And I believe in you. I believe that all of us, when we work together, instead of putting our own individual interests first, we can solve this problem together. It first begins with masks, with social distancing, and vaccinations. And helping not just myself, but my brothers, my sisters, our neighbors, our fellow neighboring countries, and even the whole world. It begins with the man in the mirror.
That's great. These are some really, really encouraging messages, and a lot comes back to where we started, right? With wear a mask, try and stop the spread, and protect the other. Don't wear the mask for yourself. Wear the mask for protection of others. Take the vaccination so you can fight the replication of the virus. So, and your last comment I felt is very strong. Work together in the communities, work together between countries, help each other. That is actually how we can move forward as a
So ironically, the more selfish we are, actually the worse we actually hurt ourselves.
Yeah. Right.
Yeah, we just need to cooperate together and work together.
So I think we've reached the end of the panel discussion. I want to thank Erica to Kuala Lumpur. Thanks for joining us over the air. I want to thank Prem for sharing your insights. And Honam, this was really great news, exciting news. And for me, I've learned a lot during this 1 hour. I want to thank all the participants, the audience joining in, answering, asking questions and answering our questions. And in a couple of weeks' time, we'll have our second installment of this series. I want to thank the team. I want to thank Mount Elizabeth Novena here for being the host in the chairman suite, which is not occupied today. So we were allowed to come here during this panel discussion. Thanks a lot for everybody for joining. And we'll be in touch over the next couple of weeks. Thank you.
Thank you.
Thank you.